like that. Taking care of yourself is a love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself.
Good evening, my viewing audience. In with this week's edition of Health Matters, I am your host, Shevaneé Nisbett, Senior Health Educator at the Health Promotion Unit, and a Happy New Year to all of my viewers. In with this week's edition, I have with me Nurse Jessica Scarborough, who is the event coordinator for our annual prostate screening, and along with her is Dr. Cohen, and they will be telling us a little about the screening that we have every year. And so I will have them introduce themselves, and then we'll start the interview.
Good afternoon, good morning. I'm happy to be back again for, I think, either my 10th or 11th or 12th time here in Nevis helping with the screening. It's always a joy to be back here and to get out of the cold weather back in North Carolina in January. And we're pleased to be here and happy to help with the screening once again, and hope to see a lot of men on Saturday morning.
Hi, good evening. I'm Jessica Scarborough, and I'm the event coordinator for the prostate screening, which is going to be held at the occasions on Saturday, and that is Saturday the 18th of January. Registration begins at 6 a.m. and ends at 12.
All right, so there you have it. So what I'm going to do, I'm going to ask both of you to basically I'm going to ask questions that will basically probe some information about prostate cancer, and then we're going to get into the meat of it, which is about the screening. So what is prostate cancer?
So the prostate is a gland that lives in the pelvis in men, and it most likely plays a role with reproductive function. As men get older, men do become prone to having benign diseases of the prostate, such as enlargement, which can affect urine flow. But one of the things that we're here for this Saturday is to try to detect men who may have prostate cancer. There's two things that we do in order to screen men, which should be done on a yearly basis. We do an examination of the prostate by placing a finger into the rectum, which just takes about 3 to 5 seconds to do. And then there's a blood test to look for a protein that the prostate produces called PSA. So both of those procedures are necessary in order to have an adequate and thorough screening for prostate cancer. Prostate cancer becomes more common as men get older. Our target age group is men around 35 to 40 years old, especially men who have a family history of prostate cancer. Brothers, uncles, fathers, grandfathers, those are the kind of people that we'd be looking for who may have prostate cancer within the family. Those are men that definitely need to be screened at a younger age, probably starting around 40, and should be screened on a yearly basis up to about the age of 75 or so. Men of African descent, in America, we have African Americans here, Caribbean, Afro-Caribbean men are at increased risk for prostate cancer, likely due to some genetic variations of their prostate. So it's a sort of a high diseased population, and that's why Dr. Thwaites has initiated screening down here in the Eastern Caribbean to try to help with that population.
Right. And so what are some of the symptoms of prostate cancer?
Yeah, and that's really the point of doing the screening, or the essence of why we screen, is because at an early stage when prostate cancer is treatable, there are no symptoms. So the urinary issues that men have, that typically is not related to prostate cancer. That's typically related to benign enlargement of the prostate. Prostate cancer causes symptoms once it spreads outside the realm of the prostate. So prostate cancer spreads into the bone a lot of times, and it can cause impingement on the spinal cord, lead to neurologic problems, bone pain, other things like that. Blood in the urine is common as well for late-stage prostate cancer. Late-stage prostate cancer, we can manage the disease, but we can't cure it. So what we're trying to do is find men at an early stage of the disease when there are plenty of treatment options available to try to cure the disease.
So tell us about the annual prostate screening.
So it's something I've been involved with for the last, like I said, 11 or 12 years ago, and Nurse Scarborough can certainly give some more details as far as that's concerned.
Okay, for the annual prostate screening in Nevis, it's held every January. Usually, we tell you registration begins from 6 o'clock. And that's where you come, you give your name, you collect your registration form, and you log your bio information, which is your name, your age, your address. the number of times you would have been screened as well too. Then you would go to the area that we call history taking. And in that area, you are requested to give your medical history, and that would involve your medical illnesses, whether you're on medication, high blood pressure, diabetes, your surgical history, your urinary history, and that is very important because we need to know how many times you get up at night to go to the bathroom. We need to know if you have to force to pass your urine. We need to know if there's hesitancy and stuff like that. So these are information that we will get at the history taking area. Once you would have done that, you would now proceed to the lab area where you would get your blood drawn. Once you get your blood drawn, we ask that you don't leave. You wait for the final stage of the examination, and that would be the rectal examination. As Dr. Cohen indicated earlier, it takes between 3 to 5 seconds. So it's usually over fairly quickly. It's a bit uncomfortable, not painful, uncomfortable, but it is something that I think all men should undertake.
All right, I'm glad that you mentioned that it's short and not painful but uncomfortable, because that is one of the deterrents for a lot of our, especially the local men here, because they don't want to have a finger in their bum, pretty much. So I'm glad that you emphasize that it's quick and painless.
Yes.
Right? Okay, and what are some of the advantages of getting screened? Now that we mentioned that it's painless, what are some things that they can basically look forward to?
I mean, I think the advantage of being screened is having peace of mind that you are in good health as far as your prostate is concerned, and that you aren't going to let something that is essentially a silent disease until it is treatable get out of hand.
Yes. And tell us about the numbers. Have the numbers increased over the years, you have said, or would you consider it successful?
The numbers have certainly increased over the years. I think the first year I was involved was 2009, I believe, and we had 80 people, and it was just myself and Dr. Thwaites who were doing the screening. We did it at the hospital at that point in time. It's a little bit chaotic and pretty much took us all day long in order to get through that many people. Now I think we could probably get through with 4 doctors that are going to be working there. We get through the screening, seeing 600, 650, 700 men within usually 4 to 5 hours. We're usually done around 12:30 or 1 o'clock or so.
Okay, we have moved from 2007, where we had 20 persons participating. Last year, our numbers rose to 650. That is a big achievement as far as I'm concerned. Persons are becoming more aware, and what we have been seeing at the screening year after year is even females, wives, daughters, sisters, they've been encouraging their male counterparts to participate in the screening. And some have even gone as far as to accompany them to the screening, which we encourage. Because a lot of times, men, when it comes to health, they always take a back seat, so they need a little push every now and then. And that is very good.
When the wives come, I always offer them a pair of gloves, too, if they want to participate in the exam.
Okay, so as I indicated, we have seen 650 persons last year. Now, I think you asked about the advantages of being screened. We go by the motto that early detection saves lives. And as Doctor would have indicated earlier, there are several options available, both in Nevis, or within the Federation of Nevis, to help with prostate cancer and abroad, which are recommended by urology associates. So once you're detected early, it gives you a much better chance of surviving. We have had persons in their late 30s who were detected with prostate cancer and would have gone off for treatment or would have had treatment here and who are doing quite well at the moment. So that's one of the advantages.
Thank you. So the fact that you said that there are persons who have gotten cancer detector, and basically you detected it before it got too late, they were able to get treatment and stuff. So do you find a lot of that happening? Would you say we have a lot of that? Basically you save a lot of lives because of that?
I mean, I would say over the years, I think that's definitely the case. And I think that Dr. Thwaites has seen what we would call a stage migration from people that were diagnosed with prostate cancer were typically 10 years ago, 15 years ago at a later stage than what we're diagnosing now. So it's good to see that, I see a lot of men that come in on a yearly basis and tell me that they do it every single year and do it religiously. And we still see a number of men who are still first timers as well, men from their 40s all the way into their 50s and 60s that are finally getting the message that this is something that's important for them to do. Again, to try to find cancer when it is at a treatable stage and it's going to have a minimal impact on your life.
Right. And if someone was to miss the prostate screening on Saturday, right? Do we offer prostate screening in the federation just for someone who they happen to miss it, they still wanna get screened? Is that possible?
We would do the screening. Typically, we do the screening on St. Kitts in July as well, so that certainly is an option. And we see, men from both Nevis and St. Kitts in both locations when we do the screening. And then
Dr. Thwaites visits every month, and we do offer prostate screening at those consultations as well too. Added to that, there are other local doctors who does prostate screening as well.
And before we wrap up, I want you to please emphasize again on who is at risk for prostate cancer and what are some of the things that men can continuously do to prevent themselves from, basically developing cancer, prostate cancer.
I always tell people what's good for the heart and good for the rest of your body is also good for your prostate. So, a healthy diet, minimizing fried foods, Heineken on a daily basis, I think, is important as well.
Is important?
Is important, yeah. It's important for prostate health. But in general, as a general rule of thumb, what's good for the heart is good for the rest of the body, including the prostate. So a healthy, active lifestyle is very important. Men, I would say, starting around the age, since this is a high-risk population, starting around the age of 40 to 45. And for men that know that they do have a family history of prostate cancer with a brother or an uncle or a father who may have been diagnosed with prostate cancer, should probably start around the age of 35 to 40. And it's something that should be done on a yearly basis.
All right. And any final words to encourage individuals to come to the screening on Saturday? Either both of you.
I think I look forward for myself, Dr. Thwaites, Dr. Caruso, and Dr. Gomez, who are coming from the South Florida area to help. We all look forward to being there and lending our services and trying to help as many men as possible.
As I indicated earlier, early detection saves lives. We go by that motto. It is essential that you get screened every year. I know there are some persons who tends to say or have the tendency to say, I was screened last year, everything was fine, I don't need to come back next year. However, changes can take place. In order for us to find those changes or for you to get those changes at the early stage, you need to be screened every year. So I'm going to take this opportunity to encourage all males in Nevis, as well as St. Kitts, because St. Kitts persons do come over, despite the fact that we have that screening over there. I'm going to take the opportunity to encourage you, once you're between the ages of 40 to 75, and you're in the high-risk group from 35, we do encourage you to come out on Saturday for your prostate screening. Registration begins at 6, ends at 12. We do say end at 12. However, if persons are still in line, you will be screened.
And I forgot to ask, how long does the whole procedure take? From registration to leaving, like for one person. I'm not talking about like waiting, about how long would the average male be there for?
Probably better to answer that.
Okay, if we are to go without the long wait or the high numbers of persons, the process would usually take 15 minutes or less. Okay. From registration through history taken, your lab, and your final rectal examination, approximately 15 minutes. Okay.
All right, and that has been our prostate screening interview. And remember, it's taking place this Saturday, January the 18th, starting at 6 a.m., right? Mm-hmm. The registration is at 6 a.m. And the doors open at what time?
And we start seeing patients around 8 o'clock.
Okay, they start seeing patients at 8 o'clock. So registration is at 6 a.m. And even though it sounds like it's 2 hours early, trust me, there are people there at 6 a.m. sometimes earlier waiting to get there because they want to get, from 3 a.m., they want to get in and get out. So the earlier you are, the earlier you get in to see the doctor, the earlier you get out. I would also like to take this opportunity on behalf of the men that go, the men that are going to go, the family members of those that take part, to thank Urology Associates, Dr. Thwaites and the other doctors, Dr. Cohen and Nurse Scarborough, and all the volunteers for continuously doing good in the community by getting the men to get screened. And it's free of charge, so that's also important. This is something that everyone should take advantage of because you don't find this everywhere. You're getting a free prostate cancer screening, and I think it's important that we take advantage of it. So I would like to publicly thank all of you for doing such a good job over the years. It's been 13 years? 14 years. So next year will be 15 years. So that's a long time to dedicate, and you guys come religiously every year, and you're happy to do so, and we appreciate that. So that has been this week's edition of Health Matters. I would like to thank my guest, Nurse Scarborough, for the Nurse Scarborough of Urology Associates Prostate Cancer Screening. She's the events coordinator, and Dr. Cohen, who is one of the urologists of the program. I'll also like to thank you for viewing. And remember, the fruit of the week is banana. Banana is a rich source of potassium and fiber, so have some banana every day this week. Thank you.